Good evening, everybody. Welcome to this live chat. We have a special topic today. This is on diminished ovarian reserve, or in other words, reduced egg numbers. So, if you have any questions to ask, please inbox it to us and we will address them right away, or I will tell you the answers right away. Before I start, I'd like to talk briefly about the ovaries. Now, the ovaries, as you know, together with the uterus and tubes, form the important parts of the female reproductive system. The ovaries are two in number and they're situated one on either side of the uterus. And the ovaries are very important because that is where the eggs reside. The eggs are microscopic. They cannot be seen on naked eye or on a scan, but they are present within fluid-filled sacs called follicles. So we can see follicles on scan, and that's how we can tell how many eggs a person has. Basically, the eggs and the follicles are synonymous because the eggs reside within the follicles. Right. So the time when a woman has the maximum number of follicles is when she's still a fetus inside her mother's uterus. At 20 weeks of intrauterine life, a fetus has about 6 to 7 million follicles. And this number steadily decreases during the intrauterine period itself. And by the time a little baby girl is born, she has 2 million follicles. Now this number continues to decrease throughout childhood, and by the time a little girl reaches puberty in adolescence, her egg numbers about 300,000 to 400,000. And this number, after 30 to 32 years, and particularly after 35 years, the egg numbers reduce steeply, and by 38 years, a woman has only about 25,000 follicles. And at menopause, the normal age of menopause is about 50-51 years, eggs are no longer present, so a woman stops having periods. Another important fact is, as you can see, as age increases, egg numbers reduce, and it's not just the egg numbers which reduce, it is also egg quality. So there tend to be more numbers of abnormal eggs as a woman ages. You might wonder, see, all a woman needs is one egg to get pregnant. But sometimes we always wonder, or women ask me, why they cannot conceive when they're still menstruating regularly, despite being 38 years or 40 years old. We must understand that at the beginning of every cycle, that is from day 2, a group of follicles begin to grow. They usually number about 10 to 11 in a woman who has a normal ovarian reserve. Though some of these eggs are abnormal, some will be normal. And there is only one follicle among these 10 to 11 follicles which will become dominant and ovulate and release the egg, which can get fertilized and result in an embryo and a pregnancy. So when a woman has a good ovarian reserve, the chance of that one follicle or the egg contained within the follicle being normal is better. As a woman ages, egg numbers come down. Abnormal eggs increase. So maybe about 3 or 4 follicles will begin to grow in every cycle. Out of these, many of them may be abnormal, and the dominant follicle may not have a normal egg. So this results in a delay in pregnancy, an increased risk of miscarriage, and sometimes an increased risk of an abnormal baby being formed. For example, Down syndrome is more common in women over 40 years. Now we know that as a woman ages, her egg numbers tend to reduce. Nowadays, we see younger women with reduced egg numbers. This is called diminished ovarian reserve. And if a woman runs out of eggs completely before she's 40 years of age, then it's called premature ovarian failure. And these are serious things which we see these days. Now, in most cases, we don't know why this is happening so often. But there are certain risk factors. For example, if a mother has had premature menopause or periods have stopped before 40 years, then it's likely that her daughter will also have or manifest the same problem. And about 10 to 12 years prior to menopause, egg numbers reduce considerably. So they have difficulty conceiving even 10 to 12 years earlier. The next reason, sometimes some women may have a genetic problem. For example, a problem like Turner syndrome or fragile X premutation. These are a couple of abnormal genetic problems where women have no eggs or reduced numbers of eggs, or they lose their eggs very rapidly in early adulthood. Another common, very important reason is endometriosis. Now, endometriosis, endometrium is the lining within the uterus, and that lining is shed every month as a period. Now, this endometrium should be present only within the uterus, but in about 15 to 20 women of reproductive age. It can grow in other places in the abdomen and on top of the ovaries. The reason for this is still unclear, but when these endometrial deposits are found on the ovaries, every time the woman has a period, these little spots of endometriosis also bleed. And so bleeding occurs regularly, month after month, on the ovary, and after a period of time, it becomes a collection of blood, which is called a cyst. And because it contains blood, and altered blood, it is called a chocolate cyst. Now, this chocolate cyst, or these chocolate cysts, can erode into the ovaries and damage ovarian tissue and reduce the number of follicles which are present. Also, sometimes women need surgeries on the uterus, on the ovaries, for chocolate cyst removal or for other cyst removals. And this can also reduce the ovarian reserve. So these are some of the reasons why the ovary may have less number of follicles. And also, any kind of chemotherapy can reduce ovarian reserve. So now I have 7 frequently asked questions. When a lady comes and I tell her where her ovarian reserve is reduced, they're usually very confused. They ask a good number of questions. I have those questions here, and I'll answer them one by one for you. The first question is, would my periods become abnormal if my egg numbers reduce? So many women believe that if egg numbers reduce, that will reflect in their periods. Yes, it will reflect in the length of the cycle. So usually women having about 28 to 30 day cycles, as they get older or as their egg numbers reduce, can have 25 or 23 day cycles. This is an important sign. So that's the only thing. But regular menstruation does not mean that your egg numbers are normal. It needs to be tested. The second question is, would my periods become scanty? Now, usually when somebody is almost menopausal, the stimulation or the hormone stimulation from the ovaries is reduced. So the lining within the uterus may not become thick enough, and it may result in scanty periods. But usually, even in women with reduced egg numbers or diminished ovarian reserve, scanty periods may not occur. What is the best test to determine my egg numbers? So the first thing we do is, when a woman comes to us with the problem of not conceiving, we do a scan and we check the ovaries. Now, looking at the ovaries, we look at the ovarian size to see if the size is normal, and we count the number of follicles which are present in each ovary. And as I said, normal ovarian reserve should have at least 10 to 11 or 12 follicles on day 2. And if somebody has less than 5 follicles, then they're probably running out of eggs. Another important test which we do these days is AMH. It is a blood test. It is anti-malarial hormone. It can be done anytime during the cycle. And this test, if the level is less than 2.2 nanograms per ml, that shows reduced reserve. And if it's less than 1.2, it will take a longer time for women to conceive. So the next question is, when should I do the test to check? See, as I said, it can be done at any time in the cycle. But more importantly, if you're touching 30 or if you're touching 35, definitely it's important to check your ovaries to see if your ovarian reserve is normal, so that you can take advice from the fertility specialist. So many women ask, will eating specific foods improve my ovarian reserve? We always wish there were simple methods like that, or simple that will cure the condition, but there is no food which increases ovarian reserve. Can medicines be given to increase eggs? So right now, there are no medicines which can increase egg numbers. Before we plan IVF, we may give the woman testosterone gel or DHEA. Testosterone gel is said to be more effective. It doesn't increase the egg numbers, but what it does is it makes even the small follicles sensitive to hormonal stimulation. So when we start doing an IVF cycle, even these small follicles may respond and we may get an extra egg or two. So that's the only treatment. Now, as far as research goes, stem cell injections are being done, but it is still in the research phase and not available for daily practice. So what is the treatment for low egg numbers? See, once the egg numbers are found to be low, somebody has an AMH level of 1.2 and she has very few follicles, I would consider her age. If she's young, lesser than 20, lesser than 35, the prognosis is better, or the chance of her getting pregnant is better. If she's over 35, she may require more elaborate methods like IVF to get her pregnant. The duration of infertility, how long has she been trying to get pregnant? All these are the things we will take into consideration. And whether the male partner is normal. Now for ladies 35 with an AMH of 1.2 or 1.3, which is very low, and if there is a problem with the male as well, then we would definitely advise IVF. If the lady is much younger, say about 25, and she has a low ovarian reserve, say 1.3 or 1.4, we may be able to do a couple of quick IUI cycles back to back, and if she doesn't conceive, then we may think of IVF. Because IVF has a better success rate than does IUI. In women with premature ovarian failure, and they have no eggs at all, and their hormone levels are deranged, then it may be important to consider egg donation as the only option. Right, I think I have a few questions here. It says, myself, Padma, 32 years, my AMH value is 1.9. Is natural pregnancy possible? IVF is the only option. So this is a reply to Padma. IVF need not be the only option. Well, at 32 years, I think it's worthwhile trying a couple of IUI cycles quickly. And if you're not successful, then perhaps IVF. It's not the only option. But you need to use time prudently and not waste time. We have another question which says, is it possible to conceive naturally after ectopic pregnancy? Well, yes, it is possible, but we must understand if the ectopic pregnancy has resulted in the removal of one tube, then your chance for conceiving naturally will reduce. But it's still possible, it's not impossible. There's another question which says, at 34 years, postponing pregnancy or advice, please. So 34 years is a dicey age. So I think it's important to go to a fertility specialist and check. See what your AMH is, see your ovarian reserve. And if you're not planning on a pregnancy, egg freezing is a good option, where we can freeze your egg for later use, for when you're ready. So that's something which you need to consider. We have another question. Oh, we have another question. It says, I'm from Madurai. Will you be starting a center here? So, Jananam, we have only one Jananam Fertility Center in all India, and that's in Chennai. We are in Nilagiri. we believe in quality care, and I think focusing in one place on the patients and having a very, very personal involvement and individualizing treatment is possible only if we have one center. Quality to us is very, very important, and so we would like to leave it or keep it this way by operating from one center. So I don't think we'll have a center in any other place because we're very happy doing the work we do, and we get excellent results. So that's all for today. So thank you for your questions, and this is the last live chat for this year. We've had a fantastic 2018. So wish you all a Merry Christmas and a fantastic New Year.